I'm the chief of the section of MDS. So basically what this means at MD Anderson, so what this means is that my full career is dedicated basically to the care of patients with MDS and AML, and also to try to do the best work we can in terms of research so we can better understand this disease and maybe find better treatments and maybe one day a cure for this condition. So this is very important for the patients with this disease, because I think MDS, maybe it's sometimes kind of a forgotten entity just because maybe the group of patients that is affected by this condition. But for me, as a clinician and investigator in this area, is really important, because we need as much awareness as possible. And for someone who basically spends 100% of his time just trying to take care of patients with this condition, this is really fundamental. What we know is that this disease affects a group of patients that tend to be older, they tend to have comorbidities. There is no particular socioeconomic status that is affected by this disorder. But as we age and we have more comorbidities or other health issues, the manifestations of the disease, such as anemia that results in fatigue, or thrombocytopenia associated with bleeding, or the risk of transformation to acute leukemia, really together with, let's say, cardiovascular disease or some lung process, let's say COPD, or some of the other comorbidities that we develop as we age, makes the management of these patients quite complex. And indeed, actually, I believe that the type of patients that I see at MD Anderson, maybe as opposed that are seen in communities across the country, may not be 100% the same. Like if you're very fatigued and you cannot really go to a major center, or you cannot afford going to another center, that's really a major problem. So for me, actually, I believe that research in this area is so important, and access to clinical trials is so important, not at MD Anderson per se, but in your community, that for the clinicians realize that there's actually a lot of clinical trial research initiatives in the country, most likely in any state, in any major city in the United States, that to think about our patients and try to see how we can facilitate access to these studies is really fundamental, because we're really never going to make progress in terms of new therapeutics unless we treat those patients in those studies. And I personally think that the care that patients receive on a clinical trial is far superior to what you receive, outside that particular context in kind of like ad-lib type of care. So I think right now, because we still have so much work to do for our patients, and we really need to come with better approaches for the therapy of our patients, than trying to maximize that, it will be very important. So for my clinicians colleague, the plea is, if you have such a patient, please consider them for a study, because there is really no good standard of care.